Good morning, friends. I'm Dr. Aajay Shah, and today we are talking about women and heart disease. Today is the Facebook Live, as we announced. Obviously, coronavirus is the current topic, and we will put some perspective in numbers. If you look at the women and heart disease, about 700 women die every day of heart disease, heart attack, and other heart conditions. About 35 or 40 women die every day of breast cancer in America. And we have only about 57 deaths from coronavirus. So you can understand the perspective, how serious the woman and heart disease is. I will be recording a video about 5 to 10 minutes long on coronavirus, how to protect yourself today, and it will be posted tonight at 7:30 p.m. So stay tuned for coronavirus video also. But today, the most important topic is the women and heart disease because it's been a pressing topic for last many decades. Actually, matter of fact, for last about 80 or 90 years. Women mostly die from heart disease. Second common cause is breast cancer. But number one cause still for women dying from is the heart disease. So let's talk how we can tackle that. The disease, heart blockage, the disease starts, matter of fact, at age about 10. And there are a lot of factors we'll talk about it. So let's look at some pictures and slides to see what heart disease is. See the picture on this screen where on the upper right corner are the coronary arteries, which are the arteries from the arteries on the surface of the heart. These arteries actually supply the blood to the heart, and heart being a muscle like any other cell requires oxygen and nutrients to the heart. This coronary artery starts getting plaque buildup, like I said, starting at age 10. And we have seen in Korean soldiers when they died in a war-related accidents, as well as young people who died in car accidents, we saw that they already had a as early as age 10. By 20, most of us have some fatty streaks or fatty plaque buildup in our arteries. Once the plaque is above 70%, as you can see on the right lower picture, once a blockade is about 70%, you start getting symptoms. And symptoms typically are chest pain. We'll talk about that more. When the blockade is about 20 to 70%, you typically don't have symptoms, but this plaque can rupture, can cause a clot, and can cause a sudden heart attack. So all plaques are important, including 20 to 70% plaque buildup. But 70% or above plaque will cause the heart attack. Again, plaque rupture is a very concerning. When the plaque rupture happens, a small clot forms around the plaque rupture and it closes up the lumen, the opening completely, and blood flow stops completely to the heart muscle and heart attack happens. Once the heart attack starts happening, time is very important. You need to get to the hospital right away. We'll talk about that also. So let's look at the risk factor for heart blockage. The most common risk factor obviously is age. As we get older, more heart attacks happens, particularly after age 55 in women and after age 45, 50 in men. Gender is also important. More male get heart blockage and heart attack than female. Female actually catch up to the risk after age 65, and after age 75, 80, actually women start to get more death from the heart disease. The third risk factor is high blood pressure, which is defined as any blood pressure above 120 over 80. High blood pressure is as common as 50% of Americans. The next risk factor is having high LDL, the high bad cholesterol, which typically once it's above 130 start to cause heart plaque buildup. So we need to keep our LDL low, which we'll talk about it. Also having low HDL, the good cholesterol, low HDL is also a risk factor for having heart blockage. Diabetes and prediabetes is definitely a risk factor for having heart blockage and heart attack. Smoking is a major risk factor. Fortunately, smoking has gone down. When I came to United States, smoking was about 27%. That was in 1986. Now the smoking fortunately has come down to 17%. Obviously, smoking needs to go down to 0%, and my hope is it will happen. Obesity is the next risk factor. Any BMI about 25, particularly BMI about 30, which is the obesity, can cause heart blockage. Family history is very important. If you have a strong family history of premature heart blockage, like in in a male before age 45 and female before age 55, then you are at risk of developing heart blockage. Inactivity or less exercise, less physical activity also is a risk factor for heart blockage. Any kind of high stress, chronic stress particularly, is also one of the risk factors for heart blockage. So let's talk about symptoms of heart blockage. There are many common symptoms. Once a blockage is above 70%, you will start getting chest pain on exertion. So for example, if you are shoveling the snow, or if you are mowing the yard, or if you're doing any kind of housework, or if you're walking on a treadmill or elliptical, and if you start getting chest pressure, chest heaviness, chest tightness, and if it goes away when you stop what activity you are doing, then that's a classic pain from the heart blockage. If you're having these symptoms, make sure you reach out to your primary care physician or your cardiologist. If you're getting shortness of breath on exertion, that also can be a sign of heart blockage. Particularly if you are diabetic, and if you are getting shortness of breath on exertion, that could be a sure sign of heart blockage. And do not ignore any shortness of breath, particularly if you are diabetic. The next symptom is fatigue. If you're having unexplained tiredness, unexplained shortness of breath, that could be a sign of heart blockage, particularly in diabetic. In women, the symptoms are different. We'll talk about it in a second. If you're having exertional back pain, that also can be a sign of heart blockage. If you're having any indigestion type feeling, that also can be a sign of heart blockage. If you have upper belly pain or upper abdominal pain, that can be also a sign of heart blockage. If you have a jaw pain or toothache with exertion, that can be also a sign of heart blockage. In women, the symptoms are many times different. In women, they typically don't get classic chest pain on exertion, but they will get more fatigue feeling, they will get back pain, they will get shoulder pain, they will get belly pain, and many times these symptoms are ignored by physicians and healthcare providers, thinking that this probably is not from the heart blockage. So again, if you have women, if you're having any exertional symptoms, make sure you insist your doctor that could it be a heart blockage. Then we are talking about what are the symptoms of heart attack. When the heart blockage happens, typically you have exertional symptoms. But when the plaque ruptures, like we talked about it, plaque ruptures cause sudden stoppage of all the blood flow, and that actually leads to heart attack. So if you are having any chest pain, pressure, heaviness, tightness, radiating to your left arm, along with sweaty feeling, shortness of breath, fatigue, and if you are at rest, that could be a sign of heart attack. If that's the case, this is a medical emergency. Call 911 and take an aspirin. Take a full aspirin, because heart attack can lead to passing out episode, sudden cardiac death or cardiac arrest, and that could be pretty deadly. So if you're having any symptoms of rest, of chest pain, pressure, heaviness, tightness, radiating to your left arm with sweaty feeling, call 911, because that could be a heart attack. So let's see what things you can do to diagnose the heart blockage. To diagnose the heart blockage, typically a physician would order a stress test. Stress test is a test where you walk on a treadmill, electrodes or wires are connected to your chest wall, and it monitors your heart activity. If you have any heart blockage, there will be some EKG changes, and that can tell you whether a person has a heart blockage or not. Sometimes we do stress tests, walking stress tests with pictures of the heart, either nuclear pictures or echocardiogram pictures. And those are, we call stress imaging studies. Sometimes a person cannot walk because of a bad knee or bad lung, or if a person had a stroke or has a bad leg blockage, then we do a chemical stress test where we give you a medicine and then take pictures of the heart. This test is as good as walking stress test. The next test, which is very common, many of you have heard about it, some of you already had it, is coronary angiogram or cardiac catheterization, where a small catheter, typically through an artery in your wrist, introduced and travel to up to the heart, and a dye is injected and pictures are taken. This test is pretty much 100% diagnostic test. It's a gold standard, and it can look at the blockage for sure. So if you really need the answer, cardiac catheterization or coronary angiogram is the right test to do. The next test we sometimes do for screening is coronary calcium scoring. Coronary calcium scoring is the one where you have a CAT scan done of your coronary arteries just within 30 seconds to 1 minute, and it identifies how much calcium you have in your plaques in your arteries. If you have a certain score, particularly score above 400, that could be a sign of some serious blockage. If your calcium score is above 1000, that's a very serious condition, and in my opinion, you should definitely get cardiac catheterization done. For example, my score was 142, which for my age almost reasonable. It should be zero ideally. A lot of people at my age have scored zero, and I'm trying to keep my score steady for last 2-3 years by exercising, eating healthy, and keeping my cholesterol low. So again, calcium scoring is another important test. You also can have a coronary angiogram with a CAT scan, we call CTA of the coronary arteries, where you don't need cardiac catheterization, and you can actually have angiogram done through the CAT scan. This test is also very accurate, particularly in young people, and if we think the person doesn't have a blockage, then we typically don't submit them to cardiac catheterization because it's more invasive test, and we order this coronary CTA, which is non-invasive. So let's talk about how we treat the heart blockage. The commonest way we treat the heart blockage is with medications. Aspirin obviously is a mainstay. Aspirin thins the blood, inhibits the platelets, and it prevents a clot formation at the plaque and prevents a heart attack. Other common medication is beta blocker like metoprolol or atenolol. Those medications actually lower the oxygen demand of your heart muscle cells and can tolerate a heart blockage better. The next medication is nitrates. You must have heard about it. A lot of people taking a small nitroglycerin pill under their tongue. This pill actually opens up the coronary arteries, lowers the blood coming to the heart, lowers the heart demand, and actually can make you chest pain free. The next medication is some of the other newer blood thinners which we use after the stents. The next procedure we use to treat the heart blockage is stents. Stents have been around for now 25, 27, 30 years almost. Stents actually, in my opinion, has been a breakthrough in cardiac treatment. Stent is a small mesh or spring type device which you put it in the coronary arteries while you do the catheterization, open up the blockage, and then scaffold the blockage on the side, and blood can go through. Stent typically can last for life. Sometimes stent re-narrowing can also happen, but if you keep your cholesterol low and if you take certain medications, your stent re-narrowing will be less. Many of my patients asking me, do I need to take the stent out? Stent typically do not need to take out once you put it in. Stent actually, if you take care of yourself, you can have only one-time stent and hopefully never need a stent again. And the last ultimate procedure, which unfortunately many people have to go through, is the bypass surgery. Bypass surgery is more of an invasive procedure where you cut open the chest, take the veins from the leg, and take an artery from the chest wall and bypass the blockage by putting that artery from the aorta to the distal or to the more downstream to the blockage where the blockage is. So again, this is the bypass surgery. Fortunately, bypass surgeries have gone down because stents are becoming more and more widely available and more frequently used and much more safer. So what can we do to prevent the heart blockage? Obviously, number one is start very early. Like I said, heart blockage starts at age 10. So prevention starts at age 10. So if you are 40 years old, do it for yourself, but do it for your kids too, because your kids will start getting heart blockage at age 10. So do it for yourself, do it for your kids. So how can you do that? Employ whole food plant-based diet. Typically, plant-based diet have very low saturated fat. So try to avoid any meat products which has a lot of saturated fat. Try to avoid all oil because vegetable oils also have saturated fat, and many of those vegetable oils can cause inflammation and can cause heart blockage. So again, eat less saturated fat, avoid vegetable oils, avoid animal products. Number two, exercise regularly. Minimum 30 minutes of physical activity, whether it's mowing the yard or shoveling the snow or hard washing the house or car, or exercising on treadmill or elliptical, or if you have bad knees, doing a bike. So some kind of exercise, minimum 30 minutes per day. I exercise every day at least 1 hour, sometimes 2 hours per day, and I feel really good about it. The next is a stress management. Stress is a major issue for developing heart blockage. Try to meditate 20 minutes once or twice a day. Try to keep stress low. Try to think positive. Try to have negative visualization, which we have recorded many videos on our Facebook page. Essentially, keeping the stress low is very important. Relationships are very important. Have a great relationship with your spouse, with your family, with your friends. All positive relationship has shown to prevent the heart blockage. Substance abuse is another thing. Alcohol definitely can cause high blood pressure, and alcohol also can eventually, being an empty calorie, can also make weight gain. So again, all these factors will lead to prevention of heart blockage, reversal of heart blockage. Once you develop the heart blockage, obviously you will need a care from your cardiologist, from your physician, and you will need to be watched very closely for any kind of symptoms if you develop. Once again, if you develop chest pain, chest pressure, heaviness, with sweating, with shortness of breath, with tired, fatigue feeling, at rest, like for example you're sitting on a couch or in a bed, that's a medical emergency. Call 911 and take an aspirin. So let's talk about some of the other heart conditions or heart disease which women can have. There's a condition called Takotsubo cardiomyopathy, which is very common in female. In this condition, stress, any kind of intense stress, for example, intense stress as much as a bad news like some family member dying, or a diagnosis of cancer, or losing a job. This kind of stress can lead to sudden weakness of the heart muscle, and that can cause cardiomyopathy or weakness of the heart muscle. This is called Takotsubo cardiomyopathy. It's more common in female. This condition actually many times is self-limiting. It resolves itself, and most people recover from it as long as the stress is eliminated. Sometimes we use medications to make the heart stronger. If you are under any kind of extreme stress, what I described before, and if you are feeling weakness, if you're feeling tired, if you are feeling leg swelling, if you're feeling short of breath, then make sure you reach out to your primary care physician or your cardiologist, and they may order an echocardiogram to see if you have a weakness of the heart muscle, the Takotsubo cardiomyopathy. The other conditions are called regular cardiomyopathy, which sometimes can happen because of virus. Virus can affect heart muscle, can make your heart weak, and that can lead to cardiomyopathy and congestive heart failure. The next cardiac condition or medical condition is SVT or supraventricular tachycardia, where your upper part of the heart starts racing fast. I see many young female with this kind of tachycardia. This tachycardia in general are very benign. They typically don't kill anybody, but they're very annoying, very nuisance. Sometimes we use medications, and sometimes we refer people, this young women, for ablation, where they eliminate a condition and they actually get cured. The next condition is obviously very concerning also, is a stroke. Stroke in female are also very common as they get older, particularly if they are obese and diabetic. There are three types of stroke: thrombotic stroke, embolic stroke, and hemorrhagic stroke. Thrombotic strokes are the one when a small clot forms in a vessel, in an artery, a blood vessel in the brain, and can hamper the blood flow, and that can lead to death of the brain cells, and that can cause a stroke. The next is embolic stroke. Embolic strokes can be from two sides. It can come from your neck, from your carotid artery. That small clot can go to your brain and can cause a stroke. And then other condition is small emboli or small clot traveling from heart to your brain. This happens typically in atrial fibrillation. Atrial fibrillation is a condition which is irregular heartbeat from the upper part of the heart. So if you have any irregular heartbeats, if you feel your pulse is irregular, make sure you reach out to your primary care physician or your cardiologist. They will do an EKG to see if you have atrial fibrillation. The next medical condition or cardiac condition is aneurysm. Aneurysm typically is more common in male, more common in smokers, but also it can happen in female. So if you have any risk factors for aneurysm, make sure you have a screening test done. The next medical condition is peripheral arterial disease. Peripheral arterial disease is the condition where your leg arteries get blockage. You typically start getting pain in your calf, thigh, and buttocks when you walk, and this actually can be very disabling. Many times you require stent or a bypass surgery on your leg. So this is a quick summary of women and heart disease. Again, uh, about 700 women will die every day of heart disease. About 30 or 40 women die of breast cancer, and only 57 corona deaths so far. So women and heart disease is very concerning, very long, been going on for last 80 years. We need to do something about it. If we work together, we'll definitely will be able to do something about it. So I'll end my live talk here. I'll take some questions. So first question is, what if you experience heart palpitations? Again, most heart palpitations are very benign, very simple, very common, very non-life threatening. Heart palpitations typically can be fast or racing beats, which is most of the time from the upper part of the heart, we call SVT or atrial fibrillation. If that's the case, your doctor may order a 2-week monitor to see exactly what kind of beats you are making. And then typically treatment would be medicine like beta blocker. The more common ones are we call skip beats or pause in the heart, which are typically from PVCs. Many times PVC are benign and non-life threatening, but PVC could be a sign of serious heart disease. If you're having any skip beats, make sure you reach out to your doctor. Next question is, what is the normal pulse rate? Normal pulse rate is between 60 and 100. Obviously, if you are an athlete, if you exercise regularly, your pulse could be below 60. For example, my pulse around 52 to 55. If you are very deconditioned and if you never exercise, your pulse could be 80 to 90 and sometimes above 100. But if your pulse is above 100, make sure you reach out to your primary care physician or your cardiologist, because that's not normal. Any pulse above 100 is normal. Any pulse below 60 is also not normal, but if you're athletic, it's okay to have pulse below 60. The next question is, what is a normal blood pressure? So normal blood pressure is 130 over 85, but ideally the best blood pressure is 120 over 80. Matter of fact, with blood pressure lower the better, as long as you're not having dizziness or lightheaded symptoms. So for example, my blood pressure used to be high. I used to be on one medication. You saw my post yesterday. I am off blood pressure medicine. I've stopped my caffeine completely, no coffee, no tea, no decaf, and no alcohol for almost 2.5 weeks. And my blood pressure now runs 116, 110, 112. So you can reverse your high blood pressure just with lifestyle changes. The next question is, can you reverse heart blockage? Yes, of course, you can reverse the heart blockage. Matter of fact, this knowledge of reversing heart blockage was proven in 1991 when Dean Ornish did a famous study where he put people on lifestyle changes and then did the coronary angiogram. And coronary angiogram showed the plaques actually have reversed. Plaques actually have to reverse. So definitely you can reverse your heart blockage if you do lifestyle changes, if you lose weight, if you control your diabetes, if you lower your cholesterol. And definitely you need to do all these lifestyle changes to prevent the heart blockage also. But you can reverse the heart blockage. So again, this was a short summary on women and heart disease. I'm going to stop now. This video will be available on Facebook page. There's a next question, which is a very important question. Does high blood pressure make your heart bigger? Yes, of course. Actually, matter of fact, when the high blood pressure stays high for many months and many years, it puts a lot of strain on the heart, and that makes heart enlarge, that makes heart muscle thick. And actually, if you have a long-standing high blood pressure, you can actually go into heart failure. I remember in 1986 to 1993, when I was new to the country, blood pressure wasn't controlled. Almost 70% of people did not have their blood pressure controlled. At that time, I saw many heart enlargement and many heart thickness because of the high blood pressure. Fortunately, blood pressure control has gotten better now, but still about 30% of people with high blood pressure, the blood pressure is not controlled. If you see your primary care physician or if you're a cardiologist, make sure you ask what your blood pressure is and try to keep it 120 over 80. If you see them and if they say your blood pressure is okay and if it was 144, it's not okay. You need to keep your blood pressure 120 over 80. So make sure you control your blood pressure 120 over 80. So again, this was a summary of my women and heart disease. We'll talk about coronavirus about 5 to 10 minute video tonight. So I'll sign off. We'll meet again. Hopefully I'll do Facebook Live 3 times a week while everybody's staying home. kids are home. So this week I'll be doing Facebook Live 3 times a week, and hopefully try to educate, try to make it more interactive. Ask me questions, and we'll keep learning together for next many decades. Thank you.